Good morning, everyone, and welcome to the National Hispanic Council on Aging to our webinar, How to Successfully Work and Engage with Latinos. My name is Christine Perez, and I'm NHCOA's Director of Programs, and it's my pleasure to be moderating today's virtual event, which is supported by the Administration of Community Living, also known as ACL. So for over 50 years, NHCOA has worked to improve the lives of Hispanic older adults, their families, and caregivers. As one of the fastest growing demographic groups in the United States, Latinos bring diverse perspectives, rich cultural heritage, and also unique experiences that enrich our society. Engaging with Latino communities not only helps address their specific needs and challenges, but also enhances overall societal resilience and innovation. By prioritizing partnership with Latino individuals and organizations, we can ensure that their voices are heard in decision-making processes, leading to more equitable policies and practices. And as we commemorate Hispanic Heritage Month, this webinar is an opportunity to highlight effective strategies and best practices in engaging with Hispanic and Latino communities. So to begin this virtual event, it's my pleasure to welcome Dr. Janita Cruz, President and CEO of the National Hispanic Council on Aging, or also known as NHCOA, and one of the nation's foremost advocates and spokespersons for diverse older adults, and has been recognized for her commitment and leadership on behalf of diverse older adults nationwide. Welcome, Dr. Cruz.
Thank you, Christine. Good morning, everyone. It's great to be here. I'd like to first of all thank and welcome our panel members who have joined from different parts of the country and who bring with them a wealth of experience, knowledge, wisdom. They are trailblazers in the Latino community. Have been working for years, so I think their their knowledge and their wisdom it will illuminate our thinking and the way we go about working with diverse populations, with Latino populations, with older adults. And so today I think it's a wonderful day to advance our mission and to improve the lives of Hispanic older adults, their caregivers, and their families. So thank you. Thank you for joining, everyone. Let's begin. So communication is a key foundational part in the fabric of society. If we are unable to effectively and compassionately communicate with one another, that fabric begins to break. And certain groups are left out, are disenfranchised. We can see this lack of effective communication in several facets of our society. And our communities deeply feel the impact. We can also witness this in our healthcare system. In the United States, Hispanics are disproportionately vulnerable to disease and other significant health risks. If they seek medical help, they are far too often met with misunderstanding, dismissal, or providers who are ill equipped to handle cultural and linguistic differences. And of course, we know that a one size fits all approach is not effective in the field of medical care, nor is it effective in any other sphere in our society. Compassionate, competent communication and engagement is the first pivotal step in making someone feel heard, feel welcome, and likely that they are part of the team and that they will follow the advice that is given to them. And in order to achieve a more equitable America, culturally competent engagement needs to be brought to the workplace, to the classroom, to medical schools, to schools of nursing, to the doctor's office, to the media, and more. You can't treat one community like any other, and thus engagement and outreach must be thoughtfully tailored to whomever you want to connect with. And so today's webinar is the beginning of this journey that we at the National Hispanic Council on Aging want to bring to you, which is share our wisdom, share our experience in how we've been able to connect, engage, and mobilize our community to improve their lives in different spheres. So with that, I'd like to turn it over to our facilitator, Christine Perez, our Director of Programs at the National Hispanic Council on Aging, for the rest of the session. Enjoy and enjoy the rest of the day.
Thank you so much, Dr. Cruz. So let's start with our panel session. So in this presentation, I will be joined by Pedro Lima, NHCOA's Finance and Project Development Manager. But first, let us start by providing an overview about the National Hispanic Council on Aging, or also known as NHCOA. So for over 50 years, we continue to be the leading national organization working to improve the lives of Hispanic older adults, their families, and caregivers. We're headquartered in Washington, D.C., and we have been a strong voice in dedicating to promoting, educating, and also advocating for research, policy, and practice in areas of economic security, health, and housing. Our mission is about helping Hispanic older adults, their families, and caregivers live their lives the fullest and in the best possible health. Our programming and work is influenced by the spirit of wanting a greater and more equitable America for our loved ones to age in peacefully and healthily. Our key priorities are the following: economic security, housing, caregiving, leadership development, and health. But before continuing with the presentation, we have a question for all of you. And it's about, do you know the difference between Hispanic and Latino? If yes or no, we invite you to type any answer that you have in mind in the chat box. So in the meantime, while you are thinking about the answer or anything that you consider, I would like to once again introduce Pedro Lima, NHCOA's Finance and Project Development Manager, to continue with the presentation.
Thank you, Christine. And I will actually go back to the question. Next slide, please. Which is, do you know the difference between Hispanic and Latino? So the term Hispanic was officially adopted in the United States in the 80 census, but that was an urge from Latino culture leaders that was trying to have presence in the census and in statistics in the United States. So because our presence in the United States have always been, rooted in, in the roots of the country, we didn't have statistics about us. Sorry about that. So then we get that Hispanic census in the 80s, and in the 90s, the word Latino was also introduced, offering alternative emphasizing geographic heritage rather than language. So pretty much the difference between those two is that Hispanic, you hear more widely, is used by our aging populations, and it refers to someone who is native or descends from a Spanish-speaking country. This definition is limited as it does not include people, for example, from Brazil, as their language is most commonly used in Brazil is Portuguese. So Latino is more expansive and includes someone who is native or descends from Latin America country. In short, Hispanic relates to language and Latino relates to geography. While there's an overlap between these groups, they are not exactly the same, and some people may identify as one and not the other, depending on their heritage and personal preference. Next slide, please. So I'm going to be talking about the diversity of the Hispanic and Latino community. And it includes, the Hispanic Latino community includes people of indigenous, Afro-Latino, Asian, and European descent, which also contributes to cultural and social diversity within the group. The diversity means that there's no single monolithic Hispanic or Latino experience. These differences influence how individuals from the community interact socially, access services, and mainly cultural practices. Acknowledging these differences when working with or understanding the Hispanic Latino population is very important. Next slide, please. So continue to mention about the diversity. People from coastal areas may have different lifestyles and forms of expression than those from mountainous or urban areas. For example, Caribbean people tend to be vocal and expressive, whereas Indians can be soft-spoken and not very opinionated. Within different regions, the levels of what is considered respectful behaviors and their traditions vary. The immigration status of Hispanics in the United States contributes greatly to their involvement and views of American society. The experience of someone who recently immigrated might be different from those who have lived in the United States for generations. And the level of education also influences how Latinos engage with their communities and in the larger society. So I'm going to be talking now about key principles when working with Latino older adults. Next slide, please. So I would like to point it out that family is highly valued in Hispanic and Latino community. We use the term familismo. This is a Spanish version. Maybe many of you have heard. If not, it's familism in English, which is a central cultural value involving dedication, commitment, and loyalty to family. Regularly spending time with one's immediate and extended family is part of familism. Please note that it involves seeking the family's help or advice as a group for important decisions. So this is important for you to learn or to understand because it impacts many Hispanic Latino patients who seek care. Usually older adults, Latino older adults want to be sure that they consult with their families when making decisions or accessing certain care. Also, many Latinos older adults live in multi-generational households. This means that two or more adult generations, including grandparents and grandchildren younger than 25, live together in the same house. Multi-generational households exist for many reasons. In some cases, several generations of the family live together to save money, maximize resources, help care of older people, provide childcare, or just because they value family culture. It's also important to mention the machismo. You might heard the term, and I'm going to give you a little more of context. In the United States, Hispanic culture refers to the customs or social institutions of all Spanish speakers, including people from Spain and Latin America. Gender roles in Hispanic culture are unique and to each family, person, or group, and don't apply to a particular country or person in general. So the gender roles they can greatly vary from family to family. While some families have equal responsibilities in the household, many cling to traditional gender roles, which can be generationally developed to create separations between male and female household responsibilities. Machismo or extreme masculine behavior can influence how men behave in society. They might be more aggressive and possessive toward women, and they also make demeaning comments and view women as inferior. This type of behavior might also compromise the type of health access and care that men receives, since men tend to refuse health care with the belief it might not be needed. And of course, also another key principle that we have is respect for older adults in the Latino community. For example, Hispanic families instill in their children the importance of honor, good manners, and respect for authority of older adults. We also tend to keep older adults closer, moving them in when they require care, for example. So the next slide, we will talk about the influence of religion and faith. In the Hispanic community, religion has traditionally played a significant role in daily activity. About 90% of Spanish-speaking world is Christian, including Catholics and Protestants. In recent years, other faith denominations have experienced growth within the US Hispanic community. So when speaking about end of life, those conversations, it's essential to understand that Latinos, we don't usually like to talk about death or their wills after dying. So in the context of Latino communities, as mentioned, I was mentioning before, many Latinos and their families may avoid conversations about end of life decisions or serious health issues because they feel like talking about it could lead to the realization of the fears. It might seem almost as inviting trouble. These beliefs often makes it difficult for healthcare professionals to have important conversations about topics like advance directives or palliative care, as the patients and their families might be reluctant to discuss them. So families often shy away from those conversations, and it is important to note that Latinos' decision making is based in la familia, in the family. Uh, so our values involve dedication, commitment, loyalty, respect, and care for our loved ones. We need to honor the voices of our loved ones' last wishes, whether we agree or not with them. And as an organization, we at NHCOA we always recommend that doctors and other health providers engage in effective end-of-life care conversations with their patients. We can also take advantage of our closeness to La Familia by utilizing family holidays like Memorial Day, for example, that happens in May, to talk about um, to talk ahead of time about what we want, what the family want on the end of their lives. It's also good to partner with national organizations, and we do partner with one such as Compassionate Choices that promote and educate about end of life conversations. So I'll talk a little more about all of that in the next slides. So the next slide is the respect for medical providers, and which is I'm going to now provide another view from medical side, which is the healthcare providers for the Latino people. They are equivalent of a city major. Let's see that as an example. So Latinos, they look up for the healthcare providers and they treat them with great deal of respect. This is a two-edged sword since it helps healthcare providers deliver messages. So Latinos will trust them, but on the other hand, Latinos behave in a very submissive way when dealing with healthcare providers. And this can impact the adherence to medical guidance. So often, Latinos will be told by the healthcare providers to take their medications. They will go over the guidelines. But then when the patient comes home, they tend to make mistakes because they didn't understand how to administer it, and they were probably shy or asking further questions or getting back to the medical provider. So it's very important to have the human connection. It is important to medical providers to understand that the Latino population might look up them like in an upper position and might be threatened to be asking further questions. So it's very important to understand that this happens, and to healthcare providers to show some emotions and a simple good morning, how are you today, how has your day been going so far, this makes, a better connection between patient and healthcare provider. Also, the perception of prevention is challenging when practicing public health. We go to the doctor when you're sick and need help. That's the reality with Latinos, not for routine checkups. It is different. We usually don't practice prevention. As an example, Hispanic American high risk adults are 20% less likely than non-Hispanic white adults to have ever received a vaccine for pneumonia, for example. The next slide, I'll be talking about the language. And let's consider the following. The information should be provided in English and Spanish and in a culturally and linguistically appropriate manner. As Christine mentioned, we at NHCOA, we advocate for that, and we try to make sure that our information is always linguistically and culturally appropriate. And examples of that is using a fourth grade level information. That's what we recommend to provide, and using graphics instead of text. It's highly encouraged. Use of radio and TV is preferable for Latinos to receive information. And non-profit organizations that are trusted by the Latino community are important channels when communicating with us. Also, we can't forget that as an organization and depending on community you serve, it's great to have bilingual staff when working with Latinos. If that's not possible, that's okay, but we recommend hiring translation services that can facilitate conversations with Spanish speakers only. So now I will move and I'll talk a little more about challenges to be considered. And you can change the slide to the next one. And the first, it's immigration. So as I have mentioned before, Latinos live in multi-generational households, which may also have various types of immigration status. As a result, there might be fear of seeking health and social services. There is also back and forth migration, especially among older adults. For example, some older adults, they might prefer to be in Latin America during wintertime here in the US and then return home when it gets warmer. Of course, after they retire. But in the same household, we might have people in multi-generational coming in and out time to time. So the next slide, we will talk about the lack of insurance. And it's significant to note that Hispanics have the highest uninsured rates of any racial or ethnic group within the United States. Just to give an example, in 2021, 17.7% of Hispanic population was not covered by health insurance, when compared to 5.7% of non-Hispanic white population. And this data you can find in the Census Bureau report. So the uninsured rate varies among Hispanic subgroups. For example, we have a 20.3% of Mexicans uninsured, 8% Puerto Ricans, 14% Cubans, and 19.4% Central Americans. They all report uninsured. The higher uninsured rate is often linked to a combination of factors, such as unemployment, employment in sectors that do not provide health insurance benefits, immigration status, language barrier, and lack of awareness of eligibility of public programs. So I will insist in reinforcing that Latinos often qualify for certain services, but they don't use them because they don't know how to access, or they don't think they need them, depending on the lack of their education. So some seniors, for example, they might think children need more nutrition services than they do. So of course, that's a problem, speaking of the insurance and health care system. Next slide, please. I'm gonna mention about the transportation, the lack of transportation. And more than 1 in 5 Americans, older Americans, older than 65 are not driving. So the demand for transportation is increasing. older adults prefer to use public transportation that is close to their homes. However, it's very common that they do not find actual routes and hours of service that match their desired travel patterns. It's a fact that a significant of Latinos don't have access to transportation. This creates a barrier to accessing services such as going to healthcare providers, getting vaccinated, and some groceries, among others. And there is also the digital divide. The next slide, please. Which also is a problem since many Latinos are disconnected from the digital world. There is a lack of knowledge about how to use computers, tablets, and even smartphones, which can allow them to have virtual medical appointments and access to information. During the pandemic, this digital divide became very apparent and significant challenge to getting information out to Latinos, particularly to seniors. So I will mention now on my last minutes that I have two programs that have created. So it's an overview so you all from can understand that we saw what we're facing as the challenges we're facing as a community and things we're trying to do to help our older adult population. So the next slide, please. I'm going to talk about the Ageless Tech Program, which is a program that aims to bridge the digital divide among seniors by providing them with skills and resources necessary to navigate modern technology, and this includes using smartphone, tablets, computers, and accessing essential services online. The next slide, I'm going to talk. Our main goals when creating this program was very basic digital literacy. Its classes focus on teaching basic skills such as using email, browsing internet, or accessing social media platforms. We also try to provide safety and and privacy online, so other adults can learn how to protect their personal information, recognize scams, and navigate secure websites. We also, next slide please, we also have created the NHCOA Resource Center, and that resource center, as I mentioned before, there was an idea that it was an urge, an idea that came very apparent during the pandemic when we realized that older adults were not getting vaccinated or not getting information as fast as other populations. So other adults from Hispanic background, of course, compared to other older adults. So we created this resource center, and it's to offer vital support to seniors across the whole country, especially for Latino and Hispanic communities. So one of the services, some services we offer is connecting seniors to social services with healthcare services, social security benefits, food assistance programs, and housing resource. We also provide translation and language support. So we do recognize language barrier is faced by many older adults, and so we at NACO we provide translation services to help them communicate more effectively when accessing services. And we also um, help seniors to understand and complete forms and documents, to navigate government systems and access available community resource. So you go to the next slide, please. And so we at NACOA, our effort is to ensure that seniors, particularly those who are Spanish speaking, are not left isolated, but supported, empowered, and connected to essential services, enhancing their well-being and integration into the broader community. Thank you, and I will turn it over to Christine.
Thank you, Pedro, so much for your presentation. So again, I want to remind all of you that at the end of the panel session, we will have a question and answer session. So please feel free to write your questions in the chat box. So our next speaker is Dr. Corazon. He is the Executive Director for DH Perfil Latino TV, Inc., a community-based organization that produces a multicultural, bilingual weekly television program. The organization, which addresses community and immigrant issues in the South Jersey area, is an affiliate of the National Hispanic Council and 18 as well. Dr. Farizan's support for immigrants initiatives and senior empowerment is a personal commitment to improving lives in general. So today, Dr. Farizan will speak about the role of media and promotores de salud, or community health workers, in getting information out to Latinos. Welcome, Dr. Farizan.
Thank you very much, Christine, for such a nice introduction. It's my pleasure to be talking to you, all of who are listening today. Thank you also, Dr. Cruz, for the invitation. So I'm going to be talking about how to successfully engage work with Latinos. Especially, we're going to do talking about an initiative to reach younger Latinos. In addition to what we're doing on TV and the social media, we have done an experiment last year about and training training younger adults and make them reach out to the community. Next slide, please. So this is an overview of what we've done over the course of decades. We have recruited a number of volunteers, many volunteers we have in Perfil Latino. But lately we have dedicated more time to recruit younger volunteers in a special initiative. That's what we'll be talking about. Let me give you a brief history of Perfil Latino. Perfil Latino is a 501c3 organization. We've been in business for about 25 years, something like that. We are located in Millville, New Jersey. This is South Jersey, especially in Cumberland County and other neighborhood county. If you don't know where is Millville, New Jersey, I'll give you an idea. We are about 1 hour from Philadelphia, and then we are about 1 hour from Atlantic City. So anytime if you come into Atlantic City or if you're coming from Philadelphia, you want to stop in Millville for a little tour, you can visit us. Just you have to budget about an hour of driving to come and another hour of driving to go back to where you started. Next slide, please. So youth leaders are trained and they go to do small presentation in school. That's what we've done in the past year to enhance our media production because remember when we started COVID, people were isolated. We didn't have school. We didn't have activities in the churches. So we thought it was a good idea to see if our youth can get more involved. So one leaders, especially Rosita, she shines and she delivers. Next slide. So what we've done, we had a small presentation format that has worked very well. But the most common issue was that it needed to be brought to the superiors to be considered. So before we go to any school, we had to submit our presentation to the principal, to the supervisor of the school to see if the material content is not, it was not offensive to children, it was okay also with the parents. On the other hand, we struggle with the technology because when we go to the school, the student laptops were blocked to access links that were from anyone outside of the school. So from this point on, we switched to issuing surveys on paper because our initiative was structured on using the technology for the participant to fill out the surveys. But when we see that was not working very well in the school setting, so we had to do surveys on paper. Next slide. So this is Rosita. She's all the way on the right. So she was really instrumental to gather small groups. That worked best than going larger group in the school. So you can see her here trying to catch up with other students, other youth in their school. Next slide, please. So we also attended multiple sport events to reach the youth where they are or where they go. So you can see a couple of pictures here where she's distributing the paper surveys to people in a stadium, and also when she's talking to people over there in a stadium. So she has done a fantastic job reaching out to people, spreading out of messages, reaching out to people where they go. Next slide. Okay, so we are very strong in the churches, especially the Camden diocese. We do a lot of activities with them, either on retreats or on activity when they give us the opportunity to participate. For example, we have an annual health fair that we've been doing in the month of October to get people vaccinated against the flu. That's for older adults. But we were also able to get access to the Sunday schools. And then we did presentation at the Sunday school, and we were able to circulate the surveys. And then because the Sunday school just sometime before the regular mass or after the regular mass, we were able to use this time to have the student fill out the surveys after Rosita has done the presentation. Next one. So this new initiative to reach out to young adults, that's went very well. The enthusiasm of our trained young leader was remarkable, and she was able to spread the words of our mission to improve or encourage also self-care. So that's what we are focusing on, like people with chronic disease or people with heart disease. We were able to have them understand that self-care is very important. And we use the youth in that case because maybe the youth doesn't have any of those conditions. Some of them might. The majority of them will not have those conditions, but they can help their grandparents, they can help their parents to manage their condition. So that was an important factor in our initiative to get the youth to understand how they can help their parents, their grandparents, their uncle, their aunts who are suffering of chronic disease. Next slide again. So we also attend a number of events, especially events that are empowering women empowerment events for young girls. Since Rosita is a young girl, she's very involved in the community. She's also an artist. So she was able to have this convocatoria, as we call them, and then a lot of those young girls can follow her. So you can see she's there present at an event, and then she can distribute material at the event. So one of the event has a great turnout with about 1,000 kids being present. And at those events, what we have done, we've donated raffle baskets, and so we get a raffle basket from different organizations or different places. And then when you do the survey, you are allowed. We give you tickets and you participate in the raffle. So we give you the survey, you fill out the survey. When you get the survey back to us, we give you a ticket to participate in the raffle. That was also interesting for some kind of incentive for people to participate. Next slide. So on the 19th day of March, we put a bilingual fair for the local community with activities and free ice cream. They love that activity. Free ice cream. Who doesn't love free ice cream? Over 200 people attended. So that was a family event that was done at the church in Bridgeton, New Jersey. And then, in addition to the free ice cream, they had also fun activities. And of course, we take the opportunity to give them some health information and more. So it was still a little bit cold. You can see me over here at the bottom on the left, little guy also, if you can see me over there. I was there trying to make sure that people are following what they need to follow, motivating them to participate in the activities. Next slide, please. So this is what we created a flyer both in English and in Spanish, because the majority of people attending those events, they're usually more Spanish speakers, and to advertise the event on our social media accounts. We also put up flyers in public buildings so that people will hear about our event. So we reached out a total of 1,865 people on Facebook. So that was really good. Next slide, please. So to encourage young adults to take our surveys, we already talked about that. We gave free ice cream to everyone in attendance at this event. What we the outcome was we received 97 surveys from every young person who attended the event. Although we just said that 300 people attended the event, but our target population was young adult under 18. So out of those 300, we had 97 surveys returned. So as people waited in line for the ice cream, we presented our health information. So that's what is been doing. Also, Perfil Latino partner with Jefferson Health. They're based in Philadelphia, Pennsylvania. They're a great partner. They attended as well, and they bring gift for everyone to enjoy. We had also free COVID-19 tests, the test kit from the New Jersey Department of Health. This also was available on that time. Next slide, please. All right. So in conclusion, what we found out is that using young trained leaders was very effective to work with younger Latinos. The idea was to inform and promote self-help care from the voices of peers, and always recommending regular doctor's visit. That was interesting because they listen better when they talk to Rosita. They kind of listen to her better because she speaks the language, and then she also have close to their age group, so they listen to her better if there was even other adults or some other people that double their age was talking to them. And then we also make the recommendation for them to continue with their regular doctor visits. With that, I've already went over 30 seconds for my 12 minutes allotted. I think Christine will be agree with me. I didn't go too much.
Thank you so much, Agent Horizon. No worries about that.
Very good.
So again, thank you, Dr. Horizon. And I would like to remind all of you that at the end of the panel session, we will have a question and answer session. So please feel free to write your questions in the chat box. And our next speaker is Elizabeth Jimenez, who has been a passionate advocate of seniors in her community since beginning her work at the Mexican American Opportunity Foundation, also known as MAO, a nonprofit organization based in Los Angeles, California. She is the project director for a multi-purpose senior services program that offers over 2,650 meals weekly to low-income seniors, some of whom are homebound and rural. In addition, the program provides wellness classes, benefit enrollment services, case management, information, and assistance resources, transportation, and a food bank. Today, Ms. Jimenez will highlight effective strategies to work with Latinos in California. Welcome, Ms. Jimenez.
Thank you so much. Thank you for having me and be part of this panel that is so important, especially to share the strategies that we use to target the Latino community. So I want to start, Christine. on the services that we provide to the senior population, please? This is history of the Mexican American Opportunity Foundation. It gives you a little bit of the history of when the our founder Dionisio Morales start providing services to the Latino community. That was in 1963. Thank you, Christina. As Christina mentioned, I am the director of the senior services. We have what is called over here the senior center, where we provide social services to the seniors, including the case management, home delivery programs, transportation, benefit enrollments, social activities. We have a food bank. We have education and vaccinations, transportation, and benefit enrollment programs. We provide services, like Christina mentioned, to over 2,000, deliver food to over 2,000 to senior homebound. Besides, we also provide meals and congregate meals on 8 centers that seniors, they come not only for the food, but also for to receive services and to receive information and different needs that they may have. I want to talk a little bit about the best practices that we use. Next, yeah, the best practices that we use to target the Latino population. And like Dr. Cruz mentioned at the beginning, I think communication is the main key to try to get for the seniors to come and request the information or that they need that they have. So we always consider the best language to reach and to engage to our target community. With so many Latinos household composed in both Spanish and English dominant speakers, conducting bilingual presentations might be the suited for the audience. However, when we target and we're talking to the seniors, we had to think about doing bilingual presentations because you may lose the attention because it can become a little bit too long for them. So we try to do in presentations according to the population that we're targeting. If we target and we know that our Latino, our seniors are only Spanish speaking, we only focus in doing the presentations in Spanish. But we also, like somebody mentioned before, we had to think about decision makers. Our seniors a lot of times depends on their families or their caregivers to make a decision. So when we have an audience that is going to be attended by their families, the young families or the caregivers, that's when we do our presentations bilingual. So that way caregivers and family, younger family, can help better to our seniors. We carefully choose how to incorporate culture elements. Example is music. It could be music, food, and language. We implement a lot of times exercise classes, so that way we can call the attentions of remember our seniors that are still very they like to move, they like to participate. So we always try to implement music, food, exercises that we can bring our communities together. We very careful about ensuring the materials and the reading level is appropriate for specific communities we serve. Written and verbal communication that is clear and accessible to them. Especially like in the health area, a lot of times the information that our seniors receive is a very high level written. Even the prescriptions of the medicine, when they receive it, sometimes they don't understand. So we very careful and we advocate for them with caregivers to please make sure that they understand what they're receiving, because if not, sometimes they stay in the middle of information because they don't understand exactly what was explained to them if they only receive it in a very high level reading information. Building trust in the community. Somebody also mentioned that. I think that is very important. I've been working with MAOF for over 35 years. And let me tell you, I think it's still, until this time, we still have new seniors or seniors that they still question the services that we provide, because if you don't have the trust of the seniors, it's going to be very difficult for them to receive the services that they need. So the trust in the community is so important, and the only way that you're going to be gaining that trust is be honest with them and try to help them as much as you can. And the other approach that we use is the person-centered approach. We still think that is one of the number ones a way to approach and to provide services to the community, because it is very difficult for them only to receive something by the mail. And even if you provide the information 100% that you think that they're gonna need, I mean, our seniors still like to see the person face to face. They like to see that probably it's another Latina talking to you. And I mean, that's the only way that a lot of times they would like to receive services. Somebody mentioned that during the pandemic, the pandemic was very difficult, especially for agencies that work directly with seniors, because the technology came very famous during that time. But unfortunately, the technology was one of the things that our seniors, a lot of the seniors, they don't have no knowledge of that. People wanted to do classes through computers, and seniors, they didn't have no computers. They didn't have no Wi-Fi. They didn't have no access to computers. So we had the opportunity, because we had the delivery of the meals, because it was an essential need, to continue having that contact with the senior. So that's when we had the opportunity, to see other needs that they have. But I think, they give us a way during the pandemic, it gave us a wake-up call, Somebody also mentioned that now classes are available to seniors. Now, little by little, seniors are taking classes, but still we have to remember our seniors, they living longer now. So we have baby boomers right now that, yeah, they have the knowledge of a little bit of knowledge of technology, or they have their grandkids or caregivers, younger caregivers, that they still can help them to navigate the technology. But we also remember that we have seniors that they're in the 80s or close to 90s or over 90s that no matter how you explain technology, still they need community-based organizations like this, uh, like the National Hispanic Council and Agency, the other other agencies that they still want to come and talk to the person, not do it through technology. So it is very important for us to don't forget that, to still try to help and assist our people, when we can. Person approach is very important. Um, Next slide, please. So we also partnered, MAOF partners. We have very good partners like NHCOA, like medical. We work with a lot of medical centers. We work with another, the Department of Aging and the City of Los Angeles and the County-owned agency to continue providing and to be updated to the services that we provide to our Latino community. And I think that's my presentation.
Thank you so much, Elizabeth, for your presentation, and thanks to all the panelists and wonderful presentations. So as we end this panel session, I would like to start with the question and answer sessions that we have several of them from the audience. And I invite all the panelists to join in as well. And the first question is, in the United States, it is considered professional to only discuss personal matters such as finances and health with the individual or their legally appointed power of attorney. But in working with Latinos, uh, the person that asked the question have been asked to speak with children or family members, often due to their better understanding of English. And the question is the following: do you have any tips for navigating these situations with sensitivity, but while protecting privacy?
That's a great question. Can I go first?
Go ahead.
Okay, good. So yes, understanding that working with Latinos is important to not just the language barriers, but also sometimes you try to develop bilingual materials, and but they don't know how to read and write, which is that's a unfortunate reality in our aging society right now. So this is very common. We face that on the daily basis. At the National Hispanic Council on Aging, these type of situations, and it's for us. It's if the patient are bringing this family member into the conversation, it's already a sign that um, they want them to be part of this discussion because they believe in them, because they trust on what they're gonna be translating or they understand them better. So it's totally fine for us to work with this community. I would say that it's important to ask for explicit consent, maybe a verbal consent from the person at least. And if the person can have a document, even better. But if just a verbal consent, it is fine. And respect the cultural of the patient that you are serving. So you can mention before you're going to give a very sensitive information. You can probably ask the person that is intermediating that of sensitive information is coming up soon. You still want me to be discussing that in front of children or the other family members, and if they still say it's fine and if they involved with it, and for us, we say it's totally fine, and it's actually not is a good in a way that the family member can also support the treatment or the services that it's being provided a, as a follow-up. So it's more than one ear to listen and more than one person to do what it's asking for.
Thank you, Pedro. Anyone else? Elizabeth, Dr. Parison?
I'm sorry, Christina, I was not able to hear the question very well.
Oh, okay. I will say it again. Yeah, the question is that if you have any tips for navigating type of situations where the person needs to speak with the children or a family member of a Latino or Hispanic adult, and they want to know if you have any tips for navigating this type of situations with sensitivity, but also protecting their privacy.
Hmm.
I
But
I think
go ahead.
I think depends on the services that they requesting. A lot of the governmental departments, they have translators at the departments that they can assist them. Um, uh, Caregivers, I mean, they become very close to also to the seniors. So I think if they trust the caregivers will be a good help for them.
Thank you, Elizabeth. And I have another question, and it's any of all of you, if you want to answer it. It's about, can you describe three challenges that you foresee the aging Latino population encountering in the coming decades?
Oh, well, the three challenges that we've been talking here over and over, it includes healthcare access and affordability, economic security, and retirement plans for older adults, Latino older adults, and I think also social isolation and access to support networks. Uh, I would say those three um, challenges that we've been talking and seeing uh, on the growth lately.
Thank you, Pedro. I
Uh,
agree with
I,
all of them too. Dr.
I
Perez.
was, yeah, I will second Pedro in those three items that he mentioned that Hispanic older adults need to focus on. But I will also probably focus more on educating them on retirement accounts because a lot of them they don't. They're like I was reading an article the other day. I'm 65 years old. The person was writing, and I don't have any saving. Can I live on Social Security only? So I said, wow. You stop because if you're only 65, you have no savings. Uh, it's going to be tough for you to build some savings from 65 until maybe you live to be 85 or 90. So yeah.
Thank you. So I have a final question because we need to wrap up. But this question is about what communication strategies are effective when working with Latino older adults. What do you recommend?
What do we recommend in what? Say that again.
Yes. What recommendation strategies are effective when working with Latino older adults?
Patience. You have to be patient. You have to be patient to understand what they want, and you have to be able to also guide them in the technology because many of the form that they need to fill out, they're easier fill online. So many of the adults have difficulty doing that. So you have to be able to guide them in the technology and be patient with their learning style. That's my thought.
Yeah, I agree. And I mean, just to complement that, as I was mentioning on my presentation earlier, that also if you're doing like writing communication, try to use more graphics over texts
Mm.
because sometimes a lot of text might confuse older adults, especially Latinos. And because, like I said, we need to understand that our population might be in lack of much education since many older adults today left their countries in an early age with no much education there, and then they didn't have the chance to develop education here. I'm not saying that's the majority, but it happens very often for those who actually are seeking for services or health services. So it's very important to use graphics, and show respect. And I would say, according, Dr. Parizan said it, be very patient, show respect. Somehow empathy, if that can be a case, to show empathy, to show that you understand them and you are trying to help them there. You're not trying to make them feel guilty about not understanding the information clearly. Every person has a timing, and we need to understand that and have that empathy. Just to finalize that, I need also, when talking or writing, try to use simple and clear language. And I know that since, with the background we have here at NHCOA, the work we've done, as simple as you can get, makes things easier. Don't try to complicate things. Try to be more, direct and assertive in that way, so people will engage and will be accepted. Um, I think that was my recommendations.
Yes, I agree with both of you, what you're saying. I also will add understanding, we have to be able to understand our especially our senior population. Remember that a lot of times they're coming from governmental departments that they don't have that probably the time, or they don't want to make the time to understand and to be patient with our with the community. So we have to understand and be patient, like Dr. Henry said. It is very important.
And just building on what Dr. Paraison, Elizabeth, and Pedro have already said, I think it's important that we practice repetition. And repetition is important for everyone, for every population, right? This is something we learn in health communication. Repetition is a way to begin to change behavior. And so it is also true for older adults that we should repeat the information in different ways and use, as Pedro indicated, use lots of popular education. Popular education means you use basic language, basic words, looking at the fourth grade level, for example, so that people can understand those simple words. And let's remember, there is a Spanish that we can all understand. There isn't such a thing that, oh, different groups speak different Spanish. We can all understand Spanish if we use words that are understood by everybody. So I think that's something that we should keep in mind. And just to reinforce the idea of being respectful, being respectful. Older adult Latinos, is do well, react well when we respect them, because our culture calls us to be respectful of our elders. Our elders are one of our greatest. This is something we grow up with. We revere our grandparents. We respect our elders. We honor their presence. And for those of us who have taken care of our parents, it is an honor. It is an honor, and that's something we applaud, and it's something that we admire about our culture. And I think it's something that we should continue to reinforce, because that's what's helping our community. And we need to figure out ways to reinforce that, enhance those messages, and help our community continue to do those great things that are important for our community and for our elders.
Thank you so much, Dr. Cruz, for that wonderful messaging, along with Pedro, Dr. Harry Horizon, and Elizabeth Jimenez. Again, thank you again to our sponsors, speakers, and attendees for joining us for today's virtual event. We encourage all of you to follow us in our NHCOA social media platforms. You can find us on X, formerly known as Twitter, Facebook, Instagram by using @NHCOA for more information about upcoming events. And let's continue advocating for programs and resources to better support older adults and, of course, their caregivers. Until the next one, thank you. Gracias.
Thank you so
Thank
much.
you.
Muchas
Thank you very
gracias.
much. Bye, everyone. Bye.
Bye. Thank you.